I'm Dr. Chinyere A.Ugorji, a 2007 graduate of American International School of Medicine with 10 years of clinical experience working as a certified nurse aide at various hospitals, long-term acute care facilities, nursing homes, with patients in their private practice from two clinical rotations here in the United States, from two graduate medical education programs, Henry Ford Internal Medicine Residency Program, Detroit, Michigan, Springfield Family Medicine Residency Program, Springfield, Illinois, from various externships and observerships, from my various preventive health fairs, where I've had the opportunity to have hands-on experience, and also a master's in business administration with an emphasis on public administration from Davenport University, Grand Rapids, Michigan, with research experience from UT Southwestern in the psychiatry department, working with Dr. Carol North and Jenna Downs, who are both awesome people. And I'm currently involved in preventive health care, offering free community health fairs and home visits with a preventive health team, and also actively recruiting people who are interested, who have a passion to be able to contribute to the preventive health care in Dallas and surrounding areas, and also in education too. And I'm presenting today on Dr. Drchikitomentoring Ustream show on today, live today. I'm going to be talking about humeral fracture. I want to thank everybody who has been supportive, who has shown an interest in this series of topics. We have a lot of exciting topics coming up on this show, and this show is designed to be able to educate healthcare professionals, especially residents in training, and also other healthcare professionals, and also non-healthcare professionals, and to be able to create a forum for them to learn about some trending topics in healthcare. So today I have a case study which I'm going to talk about. It's a very interesting case study, and I'm gonna start by talking about the case. So a 58-year-old female complains of pain in the right arm. The pain started 3 days ago after she fell on her outstretched right arm. It was treated at home with Tylenol and a sling, but the pain persisted. No loss of consciousness before or after the fall. No paralysis or loss of sensation. The pain is in the upper and middle part of the arm, increases with any movement of the arm, and is alleviated by Tylenol and rest. When asked about the delay in seeking medical assistance, the patient looked anxious and stated that his son didn't have time to take him to the hospital. Review of system is negative except as above. Allergies, aspirin, medications, Tylenol, albuterol inhaler. Past medical history, asthma, probable BPH, status post prostate surgery. Social history, no smoking, no alcohol. With a widow for the last 3 years, lives with her son who recently lost his job, walks 20 minutes every day. So at this point, I'm sure you must have a few things on the top of your head. You may have a few things that you think it could probably be due to. If you're thinking it could be due to an acromioclavicular separation, you could possibly be right. If you're thinking it's a fracture of the humerus, that's a possibility. If you're thinking it's a fracture of the clavicle, that's also a possibility too. If you're thinking it could be elder abuse, he had some features of elder abuse. He looked anxious when asked about it. You could also be on the right track too. If you're thinking that it could be the domestic abuse or domestic violence, that's also a possibility too. If you're thinking it's rotator cuff tear, that's also a possibility. If you're thinking it could be due to osteoporosis, that's also a possibility too. But hopefully at the end of the show, we'll probably learn together why it's not any of those, but humeral fracture, which is our topic for today. And I'm gonna talk about humeral fracture. What is it? Well, humeral fracture is actually defined as actually caused by direct trauma to the arm or shoulder, or by axial loading transmitted through the elbow. So the trauma has to be direct. It has to be direct on the arm. The attachments from the muscles around the humerus, which includes the pectoralis major, the deltoid, and the rotator cuff muscles, influence the degree of displacement of the proximal humeral fractures. So the humerus is actually protected by those muscles. So for it to actually be broken, there has to be direct trauma. So that's actually one very important thing about it. There has to be direct trauma. So what causes it? Well, there are actually different types of humeral fracture depending on the location of the fracture. So the most common cause is actually a fall from standing. Other causes include motor vehicle accidents, fall involving stairs, violent muscle contraction from seizure activity. Electrical shock can also cause it too. Athletic related trauma too. Now one caveat about proximal humeral fractures are that they are often closed. And diaphyseal fractures, that's actually a location on the humerus, actually also occurs from these things that I've mentioned earlier, the fall from standing. Also, a motor vehicle accident can also cause it too. A fall from height can also cause it. Now, the one thing about stress fractures, humeral fractures, they are often missed. That most times, the patient presents with a prodrome of pain and tenderness, which actually happens prior to the injury while throwing. So they are normally located mid to distal shaft spiral um, of, of spiral of the humerus, and they are also minimally displaced. So how often does this happen? How often do we encounter humeral fractures? In our clinics or rounds, or actually in our communities. Well, the diaphyseal fractures actually account for 1.2% of all fractures, and then the proximal humerus fractures account for 5.7% of all fractures. So what are the symptoms? Well, most times the patient presents with pain without trauma, and edema of the upper extremity, decreased range of motion of the upper extremity, pain that occurs with palpation or movements of the shoulder or elbow, and sometimes they have radial nerve injury. If the fracture is in the proximal location, they have a painful shoulder and a very restricted range of motion. And sometimes they have obvious deformity, which actually suggests glenohumeral dislocation. And then sometimes they have crepitus. If you palpate it, you hear like a grinding sound. And then also they have shortening of the arm too, which suggests displacement. So differential diagnosis, we actually talked about it a few minutes ago. What else could it be? Well, it could be fractures of the clavicle, it could be fractures of the humerus, it could be fractures of the elbow, fractures of the scapula, it could be acromioclavicular separation, it could be rotator cuff tear, it could be a biceps tendon rupture, it could be shoulder dislocation, it could be a humeral fracture, it could be elder abuse, it could be domestic violence. It's actually 7:38 into the show. We're talking about humeral fracture. I don't see anybody who has logged in, but if you have, just feel free to post a question or get interactive. So right now we're talking about the diagnosis. How do we diagnose humeral fracture? Somebody presents with a case study, similar case study that we just talked about, and you've had all these differentials on your mind. So what do you want to do? Well, you have to order a complete blood count with differential, a comprehensive metabolic panel. You also have to order a urinalysis, also order serum levels of relevant medications, a urine drug screen, and ethanol level, because you have to rule out the presence of any medication induced confusion or induced injury, and also make sure that the patient is not intoxicated too. Then imaging. An X-ray is actually very indispensable. So you have to order an X-ray of the right shoulder or arm, the involved arm, to detect fractures. An MRI too, a magnetic resonance imaging is also needed too. A head CT is also needed. A head computed tomography is also needed too. And this is actually to rule out any intracranial bleeding as a result of abuse, or to rule out hydrocephalus too, and also especially if they have any altered mental status, that's when it's very important. And then also you also have to order a bone density scan, and that's actually to rule out osteoporosis, which is also a differential diagnosis. And then especially if you suspect sexual violence, then you also have to order a pelvic examination with forensic evidence, and that's actually the protocol had that my previous residency program during my my community rotations. I've had that done. So treatment. Well, you have to admit the patient to the hospital because actually it's an emergency. You have to obtain a court protective order. You have to place the patient in a safe home, and then also you also have to refer to social services and adult protective services because that's the protocol. Especially if you suspect elder abuse, that's something that you have to do. And then medications, what medications are needed. Well, Tylenol is very important. And what dose do you give? 325 to 650 milligram POPR every 4 hours PRN, or 500 milligram PO every 8 hours PRN. Ibuprofen is another option. Pain is actually the indication for ibuprofen, and you give 300 to 800 milligram PO every 4 hours PRN. You have to have, for consults, you have to have psychiatry on board, and that's for patients who are demented, depressed, suicidal, disoriented, and also to determine issues of capacity. You have to have geriatrics on board. You have to have neurology or neurosurgical consultation. You also have to have orthopedics on board too. So what are the complications? What could happen even after treatment? Well, for children, you could have uneven growth because the child is still growing. And then also, you could also have osteoarthritis. These damages actually last for a long time, and they can actually cause damage to the joints and lead to osteoarthritis later on. You also have a frozen shoulder too, and that actually leads to painfully limited range of motion of the shoulder. Bone infection can also happen, especially if the bones are protruding and if germs, come in contact with the bone. And then also, you can also have nerve or blood vessel injury, and this actually need immediate action. So, of course, it varies with the treatment. It varies with how quick it's treated. It varies with the pathology and the case. And then also counseling is also very important. So you have to counsel the patient, and the most important thing that you have to counsel the patient for includes contraception, medication compliance, safe sex counseling, smoking, no alcohol, no illegal drugs, drive with seat belts, and regular exercise. And then the AHRQ, Agency for Healthcare, the Agency for Healthcare and Quality actually talks about lots of recommendations, preventive care recommendations that are needed and necessary in this patient. So for this patient, I have a very useful widget courtesy of the Agency for Healthcare Research and Quality, which is actually very useful for helping you decide what your patient needs in terms of preventive care. Because preventive care is actually what helps to promote the continuity of care and also to keep your patients healthy too. So this patient needs aspirin. That's for women aged 55 to 79. She needs cervical cancer screening. She needs colorectal cancer screening. That's for adults aged 50 years and until 75. She needs HIV screening. She needs high blood pressure screening. She needs lipid disorders. That's for women aged 45 years and older. She needs alcohol misuse counseling. She needs BRCA mutation testing. That's for people who are increased risk. That's actually a B recommendation. And then she also needs breast cancer. That's for those at increased risk. And then she also needs depression counseling. That's for adults age 18 and over. She also needs healthy diet counseling, hepatitis C virus infection screening. That's for those who are at increased risk and also born between 1945 and 1965. She also needs obesity screening, osteoporosis screening. That's for women aged 65 and older, and also type 2 diabetes mellitus screening. So that's what she needs in terms of her preventive care. So in terms of some important points, that we actually have to know about humeral fracture includes the NEAR classification. That's in contrast to the AO classification, which is no longer used right now. So an important thing about the classification is divided in terms of two components: the number of fracture parts and the displacements. And the parts include the humeral head, the greater tuberosity, the lesser tuberosity, and the humeral shaft. And then displacement is also a part of the classification. It's actually classified in terms of the parts and the displacement. So the displacement is a part is actually considered displaced if the angulation is more than 45 degrees and if the fracture is displaced by more than 1 cm. So the classification is one part fracture. That's when the fracture line involves 1 to 4 parts and none of the parts are displaced. And this actually accounts for 7 to 80% of all proximal humeral fractures and are treated conservatively. Now the two-part fracture is when the fracture lines involve 2 to 4 parts and one part is displaced. That is, it's more than 1 cm or more than 45 degrees. And the three-part fracture includes when the fracture lines involve 3 to 4 parts and the two parts are displaced. The four-part fracture is when the fracture lines involve all the parts and then 3 parts are displaced. And then this fracture is actually uncommon. You don't see the four-part fracture commonly. So and they actually need operative management. So what's our final diagnosis with all these that we've learned today about the case study? It's actually a humeral fracture. So if that's what you thought, you were actually right. How do we code for it in our clinics? Well, it's actually an ICD-9-812, an ICD-10, which is coming up soon in October 14. Very exciting. It's S442.2 or S42.4. So I have a callback question that is designed to help us to motivate us to be able to read these articles, and also designed to help us to get interactive and also to win lots of prizes. I have lots of prizes from my sponsors, who are various residency programs, various organizations who have given us gifts, which are going to be given to those who actually answer these follow-up questions by sending me the answers to my email. So the question is, humeral fracture occurs by direct trauma to the arm or shoulder or by axial loading transmitted through the elbow, true or false? Well, I'll let you answer that question, and if you get it right, you get a shot at winning some of the prizes that we actually have. This article is actually from a very from 3 articles from which are listed on my webpage. And I want to remind you all that Drchikitomentoring preventive care practice is also is still dedicated to preventing your free health care, your free health assessments, free school physicals, free sports physical, free counseling for depression and elder abuse and domestic violence, which is actually one of my special interests. It's actually a very sad situation. It creates a lot of havoc in families. It creates a lot of havoc in people's lives. It creates a lot of end effects, and that's something that education can be able to prevent, and that's what Drchikitomentoring preventive care is also dedicated to. And I'm also actively looking for people who are willing to join, who are willing to devote their time free of charge to be able to be part of my team, to go out to the community, to churches, to schools, to charity work, to be able to provide free health care. I'm willing to train. You can be able to use it as part of your CV in your career. It's a step towards creating healthy people, towards creating healthcare reform. And I want to talk about Town Wars too. That's actually a smoking cessation campaign, and there are lots of deadlines coming up this October, which are listed on my webpage. It's actually a campaign that is created for kids to be able to create awareness about smoking. We are actually giving instructions. Those instructions are listed on my webpage, and you can actually check it out. And they are kids actually create these posters, which actually are put up at various competitions, and they can be able to be used to talk about smoking cessation. It has had a lot of success in the past, and that's part of the American Academy of Family Physicians campaigns. I want to invite you to check it out for schools, for teachers. I've been sending emails out and contacting schools, and if you're interested, please don't hesitate to get back at me. And then also, I want to talk about my work for Leukemia and Lymphoma coming up on the 27th of October. I have all the information on my webpage and also on my social media too. It's a work for Leukemia and Lymphoma. All the funds will go towards Leukemia and Lymphoma. Right now, I have a 9 people team, and and a very very wonderful team. They are working hard to be able to raise funds, to be able to create awareness about leukemia and lymphoma. We've had lots of fun things in my team at the national level, at the state level, at the corporate level going on, and we are all rearing to become a champion for cure by raising $100. So far, Dr. Chiquito team has raised $29. That's the ballpark figure. We are still racing towards becoming a champion for cure. So feel free to donate. I'm accepting your donations. And we have actually been communicating with daily emails and also and I also want to thank Liz Monson for sending, that's the senior vice president campaign development, for sending out the webcast that and which I also emailed to everyone. You can also contact my team members via their emails, their web pages, and also their Facebook pages. We also have the banner contest. These banners are going to be used to create awareness about leukemia and lymphoma. And they'll be put up at events, fundraising events, on people's web pages, on people's Facebook pages. I'm still accepting answers to the Powerball questions. We talked about cholecystitis yesterday. So the Powerball question for cholecystitis is I'm pulling up my slide right here. An estimated 10 to 20% of Americans have gallstones, and as many as 1/3 of these people develop acute cholecystitis, true or false. So that's the Powerball question for yesterday. So if you know the answer to that, don't hesitate to send me an email, and I'll make sure to respond to that. The drawing will be done on Saturday, and we have an OSCE session tomorrow for all the cases that we are going to be doing this week. And then also we also are going to be talking about infectious mononucleosis on Thursday and colon adenocarcinoma on Friday. So I want to thank everybody who has logged in. We've learned a little bit about humeral fracture today, and I want to leave you with that Powerball question. Feel free to check it out. Send me an email or contact me via social media, and I can be able to put you in the drawing for Saturday. Have a wonderful day.